I had a friend of mine that was telling me about his new grad experience. This friend was a medic in the cath lab before he went to nursing school, and while he was in nursing school, he stayed, you know, PRN as needed in his cath lab. Now, typically, cath lab don't hire new grads. The reason why is because you typically need a certain amount of years critical care experience before you can work as a cath lab nurse. So once he finished nursing school, he was doing a search and he looked up and found one. He found one about an hour away from his house at a hospital I'm not going to name. And he wound up taking a position. And he was like, this must be God sent. I found this new grad cath lab position. And he was all in for it. And he took it. Said that he noticed during orientation that his cath lab had a lot of travelers, mostly travelers. They had very, very few permanent staff RNs. Most of them was just travelers. So, and the travelers were the ones who was precepting him. He said that the cath lab was really poorly ran. The manager was a radiology tech, and they were losing travelers like every week. They get in travelers, they lose travelers get in travelers, and they lose travelers, and he wound up switching preceptors every week, pretty much. And he said he had a horrible experience. Said he left that job after 2 months and found the ICU position. What I'm going to do in this part two is navigating as a new grad. I'm going to show you how to avoid some of these pitfalls. Welcome to my podcast. So how does that happen? You know, you figure by being a, new grad, you coming out of nursing school, you had a clinical experience and you kind of got comfortable with it and you looked at places you might want to go. You may say, "Hey, I want to be an L&D nurse." And you see all these jobs, you like, "Man, I picked a job, had an interview, everything's nice." And then you get to the unit and you like, "Man, this is not what they told me during the interview and what I saw when I was shadowing. This is something totally different." So where you choose is important. And I want to kind of give you guys a little bit of inside knowledge on what kind of happens because just me, I've been a preceptor for new grads. I've been a preceptor for experienced nurses, and I can kind of tell you how a lot of units operate. One of the things you have to understand is a hospital that has magnet status and a hospital without magnet status. You may say, "What is what's magnet status?" Magnet that status is really determined by some standards from the ANCC, which is the um, American Nurses Credentialing Center. And really, to be considered for magnet status, you have to have a certain standard work environment, nurse performance. You have to have a CNO, which is a chief nursing officer that at least has a master's and quality patient results. One of the things I do like about magnet status hospitals is that they have a certain amount of BSN nurses, and they, it seems like to me that it's nurse ran and it's nurse driven, and so that kind of brings me to a point of getting your BSN. For a magnet status hospital, they typically have a certain amount of nurses have to have their bachelor's. And I know when I finished, I came out with an associate's. So for me, I had to sign a contract. And the contract stated that within 2 years, I had to be in a BSN program and I had to finish in 5, which kind of gave me like a 7-year start to finish. But of course, for me, once I finished my associates, I never stopped going to school. Since I was in school mode, I figured I'm not going to stop. I'm just going to go straight on. And that's what I did. And I wound up going straight. I wound up, I just kept going. And then I I got my bachelor's. But what I like about the magnet status is that the nurses are in leadership positions. Usually, the director of the different departments are RNs, and that was a far cry from my friend's experience with the cath lab, where the manager of his department was a radiology tech, and the radiology tech does not know what the nurses do, but yet because he had been there so long by default, he was in that leadership position. But the hospital, the cath lab where my friend worked at, was not a magnet hospital. And so on magnet hospitals, one of the things that it shows is that job satisfaction. Usually, a non-magnet status hospital will have roughly about a 22% nurse turnover, where a magnet hospital usually has anywhere like maybe 10 to 12%. So you have better job satisfaction. Also, there's a really big push for collaborative culture where the staff has an input in decision making. At the magnet hospitals that I've been in, where we have interdisciplinary rounds, we have everyone there. We have the physicians, we have pharmacy there, we have therapy there. We also have nurses there, and we may have liaisons from different departments like case management or hospice, and we're all talking about each patient, and we all have different input on the care of the patient versus a hospital that you don't never see the provider, but all you see is orders pop up on the screen. It's a big difference when you're in a magnet hospital. Also, magnet hospitals tend to have lower mortality rates. So, as a new grad, one of the things that I would really look into is the hospital that you're looking at a new grad residency. Is it a magnet hospital? I would encourage you guys to look at magnet hospitals because to me those are the ones that's really pushing nurse satisfaction and really they have standards they have to maintain in order to maintain their magnet status. But I want to kind of give you some. I gave you something to look at, but I want to kind of caution you on some things. And this just come from experience and for me talking to a lot of my fellow paramedic turned RN uh, friends on what you might want to pay attention to as you're going through your journey selecting your new grad job, your new grad residency. One of them is to keep an eye open when you go through your interview and what I mean by investigate, because if they have a high level of travel nurses, that might be a bad sign. Usually your residence is a year long. And if you have, and travel contracts are typically 12, 13 weeks. So if you have a unit that have a high concentration of travel nurses and very few staff, that meant that the leadership ran the staff nurses out, which in turn is the reason why they have to get travelers. So keep in mind who's going to precept you. If a travel contract is 12, 13 weeks, then that means every 12, 13 weeks, you're going to have a new preceptor. And when you have new preceptors, especially on and on and on and on, you're not going to get any consistency in your training. Also, typically units that are staffed by travelers are pretty much understaffed, which means higher caseloads. So even a traveler may have higher caseloads. It's kind of hard for them to maintain a caseload and train you. So who's going to suffer? You. Your training's going to suffer. And also, if you don't really get good experience and a good training, what's going to happen is um, eventually you're going to make a mistake. And if you in a hospital that doesn't have a really good just culture, then the hospital system will throw you under the bus. Even though it's a lack in training, something you may not know, you can still suffer for it. And also, usually units that are staffed with a lot of travelers usually tend to have a lot of personality differences and everybody do things different. There's a lot of hostility there, and because it's really high stress and it's really toxic. So just kind of keep in mind and you can ask, say, hey, look, do you have a lot of travelers on your unit? What's the traveler to staff nurse, ratio you maintain on your unit? Those are some good things to to ask during your interview. Don't go into your interview, thirsty, like you really need the job. You really need the job. You really need to select where you go, because it doesn't matter if you in a place that you don't like, you will not stay. And that's going to hurt you in the long run, because now you, as a new grad, you may have 2 months on a unit. Like myself, I kind of got lucky. I left my job before my year was up, so I was still considered a new grad. But luckily, I found a direct hire position that took me because it counted my paramedic experience. So kind of keep that in mind. Also, in the interview, you might want to ask to shadow, and I'm gonna tell you why. If you shadow, that means you get to come in and you get to observe the nurses and what they do. Usually, when you shadow in, they're going to pair you up with an RN, and you basically going to go with that RN and just kind of watch what they do, see what they load is like, how they interact with a patient, how the unit operates. But be careful, because usually when you shadow, they're going to put you with their best, their best nurse, and someone who's in with them, and who's going to give you the best foot forward. You're going to see all the clean clothes. You're going to see all the great stuff. They're not going to pair you with someone who may tell you the truth. So my experience is you might want to talk to everybody and just kind of talk to everyone, and that'll kind of give you a good, accurate representation. True, you got some negative people out here. Some people that absolutely do not like where they are, and you got some people that just kind of like to dress stuff up. But talk to everyone. That way you can, really get a good, accurate picture of what's going on. Also, the work experience of the unit nurses is a big indicator to be cautious about. A good unit will typically have senior RNs, people who's been there for years. If you're in a unit and they tell you, hey, this nurse been here for 15 years, or then this nurse been here for 7 years, or this nurse been here for 25 years, or this nurse been here for 10 years, that's a good sign. If you're talking to, if you're in a unit and while you're shadowing, you ask a nurse how long you've been here, and everyone's been here no more than maybe a year and a half, 2 years, that may be a red flag. So, lastly, you might want to pick a hospital that you're willing to leave. And I'm just going to give you just a little bit of business. So I worked with a nurse on a unit who been with this system for 15 years, who never left the system. The whole time she's been a nurse, that's all she's known is to be at this hospital and on this unit. I found out that I was making $5 more than she was, and only had 2 years experience. And I'm gonna tell you a little something that pretty typically most people don't know. I think they do, but I don't think they pay attention to it. So typically, hospitals tend to kind of raise what they pay a new grad every year. Matter of fact, my friend just graduated from RN, graduated and became an RN, and what he was offered as a new grad was literally $7 more than what I made as a new grad in the same system. He just graduated in 2024. I graduated in 2021. The nurses that graduated when I did, they only got like a 3% raise. So he's technically probably making what they're making, if not more, if they stayed. And I'm gonna give you even better experience. I'm gonna give you even some numbers. So let's say you was making $32 an hour as a new grad. After year one, they give you this dollar raise because you completed your new grad residency. Now you're making $33 an hour. Now keep in mind, if you leave and go someplace else and apply as an experienced RN with 1 year experience, you may make $35 an hour. That's going to be a negative $2 an hour if you stay at your current position. To me, that's what my father used to call hustling backwards. What you want to do is after you. This is only a non-unionized example. Now you got unionized hospitals that kind of work a little different. This is a non-unionized hospital example. But after 1 year, leave that system, go to another system. You'll make more money. Once you get some experience there, then you can come back to your old unit, and you'll come back to that old unit. I mean, you'll come back to your old hospital making more money. So that's kind of what I want to kind of leave you guys with. It's just some of the things that you might want to watch out for. But my next episode, I'm going to kind of dig a little bit deeper, and I'm going to give you some insight on why some of these new grad residencies is really hard to really lock down. And it has more to do with the number of preceptors that are out there. So don't get upset because maybe you didn't get the job that you want. I'm gonna show you how to navigate that. So again, thank you guys, and I see you next week. Happy nursing. As always, hey, make sure you guys follow me on Instagram at Paramedic2RNinfo. Remember the number 2.